I recall as a psychiatrist coming across a research study that there were actually more people suffering from heart attacks during the World Cup because they were emotionally invested and got emotionally stressed due to the soccer matches that were going on. So I wanted to do a little bit more thorough review of how soccer and the World Cup can affect the mental health not only of the fans, but also of the players. The World Cup is one of the biggest, if not the biggest, sporting event in the world. The best soccer teams from countries all over the world come to compete to get the coveted World Cup. As you can imagine, there's a lot in line not only for the players, but also the fans. Especially the fans that have a close connection and identify with the team that their country is playing for. First of all, fans that closely identified with the soccer team, they had their amount of cortisol or stress hormone that was detected. They were able to detect it from the saliva. The cortisol levels of people who were stressed after their team lost increased. So fans were more stressed after their team loses a match. Another study wanted to assess the stock market effects of people whose soccer teams were playing. So the games are often played at odd hours for people watching from different time zones. And so people staying up late to watch the game or waking up early to watch the game can affect their sleep. They found that these people who had their sleep affected, they also got distracted, and it caused the stock market to perform not as well. Interestingly, this was more of an issue with teams that were good, because good teams will play longer in the tournament, and so their stock markets were affected more than the other teams. Those were some interesting findings that I found about mental health affecting the fans. But what about the players? Well, first of all, a study I came across shows that soccer players have to be really intelligent. This was examined in Japanese children ages 8 to 11 who were competing for like an somewhat amateur professional soccer league within that age group. So they checked the executive function of their brains. The executive functioning meaning like how they plan, organize, think, control emotion. They found that the players that were better at soccer and showed better soccer performance also had better executive functioning, showing that they kind of had to think fast, act fast, and they had not only athletic skills, but also good brain power. So then I wanted to look into questions about this topic about mental health, concussions, things like that. Overall, professional soccer players were less likely to be in a psychiatric hospital for mental health problems, suggesting that they may have had better psychological health. However, soccer players that had an injury before the season started, they had higher anxiety, and so it's thought maybe that should be treated with mental health treatment like therapy. And European soccer players in France, Sweden, Finland, they did examine soccer players and they found that some were dissatisfied with their careers and they had more problems eating healthy, more alcohol use, a little bit higher depression and anxiety in them as well. So after retirement, there were some challenges for soccer players because they were dealing with various injuries through their career, such as like severe osteoarthritis, which can happen just naturally as one ages, but more rapidly when there's wear and tear on like the joints and part of the body. Also, some of them had low social support and poor employment after their retirement from soccer. In college soccer athletes, many of them had sleep problems, and this led to decreased vigor, increased tension, depression, anger, fatigue, anxiety, worry, and concentration difficulties. In regards to concussion and brain damage, there's a large sample done with kids that played soccer, and they found that those who had previous concussions were not more likely to have mental health problems afterwards or concussion-like syndromes. Soccer players that played several years of professional soccer, and this was most significant, more than 15 years of professional soccer, they're more likely to get neurodegenerative diseases such as dementia or those sorts of brain damage. And this was more common in the people who played defending rather than like the goalkeepers. When heading the ball, there can be this repetitive trauma to the head that can cause some brain damage. This has been well studied in American football players, and it's a term called chronic traumatic encephalopathy, where repeated hits to the head, even if it doesn't leave someone unconscious, can cause subtle damages of the brain that can have long-term consequences. So there was a study that also looked at soccer in people who were suffering from the disease schizophrenia. And schizophrenia is a really difficult disease to treat sometimes. We have some medications that might help, but there's a lot of side effects with them and people don't like to take them. People who suffered from schizophrenia, there was a study that saw them playing soccer and it improved both their physical health and their psychological health. It also improved their quality of life and it helped minimize the chances of side effects that they got from the medication such as weight gain. I hope this video helped to understand a little bit more about the mental health implications of soccer. So maybe you can think twice before staying up late to watch a game or waking up early to watch a game. If your team loses, life goes on. It's not the end of the world. Try not to let it affect you too much. For players, hopefully this will shed some light on some of the long-term consequences that the sport can have. I'm sure it has a lot to help with mental and psychological health and physical health, but there are some consequences just to be aware of. Be sure to like this video, subscribe to the channel if you enjoyed it and want more videos.